Good morning, everyone, and welcome to today's web seminar on the findings from Wave 3 of the CalYOUTH study. We're very delighted to hear today from Professor Mark Courtney, who leads the study, and we're going to just give another minute or two so that people have time to log on. So again, thank you for being here, and we'll get started in about a minute or two. Okay. Again, thank you everyone for being on this morning's web seminar. My name is Amy Lemley. I'm the Executive Director of John Burton Advocates for Youth. I'm still getting used to both of those changes. For many years I was the Policy Director and we were the John Burton Foundation, but I think I've finally made the change in my mind. So we're delighted to be able to spend time together to hear about the latest findings from the CalYOUTH study. We're going to jump into it and really spend most of our time focused on that. But before we do, just want to make sure that everyone has the information to participate. If you're having any trouble with audio, the call-in number is on the screen, and we will be posting the materials and the audio at our website. And we really encourage you to submit live questions. You know, as Mark covers material, when you're thinking of it, just go on and send that question in. That's always what makes these presentations the most interesting. We have a tremendous group of people who are participating today, a very, very diverse group. We have probation officers, social workers. We have people from the Foster Youth Services Coordinating Project. We have a lot of CASAs. We have people from ILP. We have people who represent the state, a very interesting mix of people, transitional housing providers. And, you know, from whatever, perspective you're coming from, you're thinking about young people, transition age youth in foster care in California. And so you're really the experts. You're the ones who are working with young people on the ground. And, you know, by taking the time to probe this material and ask these questions, it can often be very illustrative and bring new insights and thoughts to the fore. I know our organization tremendously values those perspectives. We learn a lot from you, and you add a great deal to the conversation so that we can craft public policies that are meaningful and that actually make a difference. But it really all begins with really amazing research like this to understand what is going on, what's actually happening to young people who have been participated in extended foster care. And so to talk about that today, I'm really your moderator. I'm going to be welcoming our presenters and facilitating the question and answer. We're also joined by Lori Cappy and Lilia Grandio with IE Communications, who are going to talk to us about CalYOUTH in the Loop, which is kind of a companion effort to the CalYOUTH study. And then for the bulk of the hour, turn it over to Professor Mark Courtney. So I think many of you know Lori and know Mark, but I do want to take a few minutes to tell you a little bit about their backgrounds. Very impressive, very long time committed people to the issue of transition age youth. Lori has worked in the field for over 30 years. She's worked in this area of transition age youth in foster care, but has a very deep and important background in addressing issues of violence prevention, gun control, and a range of health and human services issues. She facilitates the California Co-Investment Partnership and is responsible for a really great publication that many of you probably receive that group produces called Insights. It recently released its newest issue, which is about the intersection between child welfare and housing. And so if you haven't seen that one yet, we really encourage you to read it, and we'll include a link to it in the follow-up materials from this web seminar. Following Lori is Mark Courtney. Mark has done so much for the field of transition age youth. He's a professor, the Samuel Dutch Professor at the School of Social Service Administration at the University of Chicago. He received his PhD and MSW from UC Berkeley, so go Bears, and his MA in Clinical Psychology from the John F. Kennedy University, and his BA from the University of California. And, Mark's name is synonymous with the, outcomes, the adult functioning of transition age foster youth. He led the Midwest study, and then we were so delighted to get Mark and his team to be able to focus on California and to help us think deeply about whether, the policy of extended foster care is actually translating into the outcomes that we all want for young people in California. So we're delighted that he's done the study with his colleagues and made time this morning to go through the findings in detail. So that's what we're going to do. And with this, I'm going to turn it over to Lori to start us off with information about CalYouth in the Loop. So Lori, I think you may be on mute.
Can you hear me now?
Yes.
Okay, thank you. Yeah, you were right. I feel like that Verizon commercial. Okay, so thanks, Amy, for that nice introduction. So I'm Lori, and I'm going to do a little tag team short presentation with my associate, Lilia Granillo, who coordinates the CalYouth in the Loop project. So can you forward me, Amy? So CalYouth in the Loop is a companion to CalYouth funded by a different set of funders called the Fund for Shared Insights. And that consists of a lot of different national funders who, for the last 4 years, have been operating under the premise that that nothing about us without us, and that includes all kinds of direct services that are underwritten, as well as research projects that are underwritten by various foundations. Some of you may be, in fact, those of you who are nonprofits on the phone, some of you may be grantees of the Fund for Shared Insights. But CalYouth in the Loop is an outreach strategy, and just like it says here, we're trying to build, and we've been, for the first 2 waves of the CalYouth study, a feedback loop so that young people from foster care and the policymakers and advocates and folks like you on the phone, the practitioners working to help youth transition to adulthood, have actually heard from the youth. The CalYouth in the study is a 90-minute, and Mark will probably go through a little bit more of the methodology. What we're doing is survey light. This is not a 90-minute survey. This is a short survey that basically is sharing the results and top-level results, particularly those that have policy implications, with youth in the field. And the idea is to get their feedback, reactions, and opinions to the study. So we extract from the study a subset of responses. I mean, there's, such a richness of responses, as you'll learn from Mark. We extract a small subset, particularly in the last few years on education and housing. And then we ask for the feedback from not the youth that were in the survey, but this is from transition age youth in general who have been in or out of foster care since they're 18. And then with this loop, we then communicate what we learn to policymakers and practitioners. And some of you may have seen us at Beyond the Bench conference, or at the Blueprint conference, or at the Child Welfare Conference, where we're very intentionally communicating these results so that we can see appropriate policy changes. So can you forward, please, Amy? So now I'm going to turn this over to Lilia, who has been designing the different feedback methodologies. So go for it, Lilia.
Thanks, Lori. So As Lori mentioned, the CalYouth study is a 90-minute interview, a lot more, of course, scientific. The way that we collect feedback from youth at large in California with experience in foster care is through the CalYouth in the Loop website, where we have a short online-based survey where we present the results of the CalYouth study and ask them for their feedback. And as you can see, it's a very straightforward web page where you enter the survey depending on whether you're in extended foster care or if you didn't enter extended foster care, with the assumption that if you land on CalYouthInTheLoop.org, which is the website, you have had experience in foster care. And we've also employed a variety of other outreach strategies to direct youth to take the survey. And actually, the survey was what we used for Wave 2 of the CalYouth study, but earlier we used paper surveys as well. And the way that we directed youth to CalYouthInTheLoop.org or any of our other survey strategies was by reaching out to them at events like employment fairs and conferences. We also used digital and social media campaigns. We have relied greatly on the outreach to intermediaries, possibly like those of you on the line today, those providing housing support, educational support, employment support, etc. And we also attempted to leverage peer-to-peer outreach. So reaching out to youth who could share the survey and CalYouth in the Loop resources with their own peers. For Wave 3, we'd like to test direct texting. So hopefully we can perhaps rely on your help and your support in testing this new method of collecting feedback. And I believe, Lori, you were going to take this. Yes.
Yeah, so, you know, those of you who know me, it's always for what, so what. So why does this matter? Why do we need these feedback loops? And, you know, from the premise of our CalYouth in the Loop is we really want to be able to better inform policy and practice. So as we've mentioned, we took selective findings from the study results, and by adding the reinforcement of CalYouth in the Loop responses, we were able to lift up, for example, a few areas that have actually resulted with help from advocates like John Burton and others, been able to highlight, for example, in a whole series of questions in both Wave 1 and Wave 2, one of the issues that got raised by the youth that was reinforced with our CalYouth in the Loop was how underutilized FAFSA was and some of the challenges with that, and general difficulty with accessing financial aid. So that is the kind of feedback that we were able to receive through the study that, you know, this last year there was both policy and practice reform and, of course, the FAFSA challenge that John Burton led. Another thing that came out of Wave 1 was the number of young people who reported that they were food insecure, which is, to me, basically saying you're hungry and you don't have enough money to cover food at the end of the month. And one of the policy implications was the number of youth that didn't know or didn't believe, or there were various hoops set up for accessing CalFresh. And I remember presenting that at a Child Welfare Council meeting, and California Department of Social Services folks immediately jumped in and did a fix to CalFresh, which is another example of hearing from youth and this survey being able to uncover what was a meliorable policy problem. And of course, housing. And I know Amy just gave a pitch for the insights issue we just did, but there's also a lot of opportunities now on the horizon for doing something about the housing challenge. Next slide. And this is my final slide to you guys, because you know, I'm very impressed with close to 200 people are on the phone right now. So many of you probably have great networks of youth that you can help us with seeking their feedback. I want to let you know it remains confidential. We will employ whatever outreach strategy you are most comfortable with if you're an intermediary. We'll share the learnings, and I want to point out that part of the Fund for Shared Insights grant is that I can compensate youth who participate. So help us launch a text campaign, help us involve peer-to-peer feedback, and invite us to your events. So that's all for me, and if you do want to get involved in the CalYouth in the Loop, please email either Lily or myself, and we'll make it happen. Okay, thank you, Amy.
Thank you very much, Lori. I've handed it over to you, Mark. You should be in the driver's seat here, and thank you again for being here. We appreciate it very much.
Okay, let me see if I can figure out how to advance the slides. Okay, excellent. That works. All right. So, hi everyone. It's great to. It's always great to engage with the California Child Welfare Services audience, both because I worked in the system there way back in the 80s, and because even though this study is of national importance and even international importance, we're presenting findings from the study at a biannual European Child Welfare Conference in a couple of months. The most important audience, of course, is the folks online right now. So that's, as you can see on your screen, those are the current members of the CalYouth team, a couple of whom have been with us for several years at this point. And what I'm going to be doing today is sharing findings from the third wave of interviews. I'm going to go very quickly through an overview of the study. I think a lot of folks are familiar with it, and it's pretty easy to find out details if you're interested by going to the Chapin Hall website. You just type in CalYouth study in any web browser, and it'll take you there. So our study is an evaluation of the impact of California Fostering Connections Act, or AB 12, on outcomes. It involves a longitudinal study of young people that we're surveying. I'm going to be talking about that today. We've also done surveys of caseworkers, and we have lots of government administrative data on important outcomes like earnings, public program participation, college enrollments through our partnership with the California Department of Social Services. So as you can see, we've talked to young people 3 times at this point, starting with young people at age 17, not yet eligible for extended care, but on the verge of making that transition to being young adults. And we were able to interview 95% of the young people we wanted to talk to at 17. We followed up with over 84% of them at 19. And we actually interviewed more people last year at age 21, a handful more than we did back when they were 19. So we've got a great response rate there, almost 85% of young people who are all 21 at that point. So they were all no longer non-minor dependents at that point. And this slide, it didn't get printed too well there, but it colors. But anyway, the 68% basically refers to the young people who we started with the 17 who are actually still in care at or very close to the 21st birthday. So one of the findings that won't be surprising to folks on the line is that the vast majority of young people who, approach that age of 18 in care in California now will still be in care. Maybe they leave and come back, but they'll be in care, about 2/3 of them, on their 21st birthday. And before I get into specific outcomes, I do want to share a very important outcome, I think, which is that the vast majority of young people remain very optimistic at age 21 about their future. So 3/5 of them are very optimistic, and another 1/3 are fairly optimistic. You see very few of them are seriously worried at this point about their future. And I think that that's really important and important for us to keep in mind as we work with them. So what I'm going to do now is really go through highlights of these Wave 3 findings. Again, this Wave 3 report, we call it the Beast number 3. It is a long report, but it is up on the Chapin Hall website. So this is kind of a teaser presentation here to give you some ideas of how young people are doing, really important dimensions, but this by no means captures everything in that report. I also want to say that I'm not going to be sharing findings that differentiate young people by, first of all, by care status, because point we talked them to 21, they were all out of care. But obviously, we're all interested in how does extended care contribute to their outcomes. Stay tuned. We are working on that report, and later this summer, we'll be releasing a report that shares everything we've learned at this point on how young people are doing at age 21 and its relationship to extended care. What I'm going to do now is just describe for you how they're doing, and I'll start with connections to positive social institutions, particularly education and employment, which is something that all young people in this age group, want to be involved in one or both of those things. So this graphic shows the percentage of young people who are connected to school or work. And basically, you can summarize the slide by saying nearly 3/4 of young people are either enrolled in school or employed. Many of them are both enrolled and employed. You can see that's about 1 in 5 are both working and in school. But 1/4 of these young people are not. And so, that's a cause for concern, something we'd want to pay attention to and address. I'm trying to page down here and it's not going. Okay. Let's keep. I seem to have lost control of the slide, Amy, so I'm not quite sure why that's the case, but.
Okay, let's try give it back to you. Here we go. You should have it back. And while we're getting up to speed here, I'm not sure exactly on my screen. Some of the graphs are looking a little avant-garde, shall we say? But if you go under handouts, you can pull that PDF down. And so you all do have access to the PDF of the presentation. So this could be a little glitch in GoToWebinar. I'm not exactly sure, but you all do have the actual web seminar presentation. So my apologies for whatever is happening in the cyber world, but I think we can still get a lot of great information. So sorry about that.
Yeah, it's pretty striking visually, but yeah, it's not. The original presentation has more traditional pie charts. But anyway, so in terms of their educational status, I think there's some great news here. 4/5 of these young people at the age of 21 have a high school diploma or equivalency. So one thing I would say is that you hear these statistics, and I've actually had to challenge a few of them in recent months. Folks are making movies and wanting to, have sensational statistics and saying, only half of youth that, ever get a high school diploma if they age out of foster care. That's just not true. In California, we still have work to do. 1/5 of them don't have a high school diploma or GED by 21, but they've come a long way since 19, where, still more than 1/3 of them didn't have that. So we're up to 4/5. And about almost 3 in 10 are currently enrolled in school, and the overwhelming majority of those enrolled in school at that point are enrolled in college. So I think that's the takeaway. We still need to have work to do in terms of making sure everybody has a high school diploma or equivalent. But the overwhelming majority of young people do by age 21, and many of them have enrolled in college. We don't have a lot of degrees yet. I don't have the data up on the screen, but they're also young, so that's not entirely surprising. So this is student loan debt, and I think the good news here is that the vast majority of these young people have no student loan debt. So that's kind of hard to see on here, but the vast majority have no student loan debt, and only a little more than 1 in 10 have $5,000 or more in student loan debt. So I think this speaks to what California has done, and the federal government, because you Pell Grants, et cetera, so that these young people, a lot of them are going to school, and very few of them are running up a serious debt, at least at the age of 21. And this speaks to something I know is of great interest in California, and that is involvement in campus support programs. And I think there's, interesting good news here, and I think there's also an indication of room for improvement, because you can see that we ask young people, were you, involved in a campus support program? You can see 1/3 of them were involved in the campus support program most of the time while they were in college. But you can see that a significant proportion, first of all, 1/4 of them don't know whether a program was offered at the school they went to, and there's a fair number of them that are involved very little. And that doesn't necessarily mean that it's not necessarily a bad thing. I mean, they may be doing fine and feel like, I'm getting the support I need through the college generally. I don't need a college campus support program. But you see, for a lot of young people, that is an important aspect of their experience. And you can also see in the report how many of them got tutoring and other kinds of support. Many of them do. Trying to toggle down. And here we go. In terms of current employment, you can see that all but maybe 1 in 10 young people had a job at some point. A bit more than half were currently employed, and about a third of the young people who were currently employed were employed full-time. We categorize as over 35 hours a week. The other thing I would note here is that the vast majority of young people who are not employed wanted to get a job. You can see that 4/5 of those who were unemployed want a job. So again, work to do there. Most of these young people who are not employed, which is, 43% at the point in time when we interviewed them, would like to have a job. And if you get into the report, you can see all the activities they're engaged in to try to obtain employment. And then you can see in terms of the vast majority have one job, but some have two, and their average hourly wage is about $12.50. So, they're working mainly in service jobs. We also get into that, what kind of work they have, et cetera. And, you can see that among those working 10 plus hours a week, most of them are working one job. As I said, a big chunk of them are working full time. And then lastly, just to give you a sense of their economic assets, about half the young people have a checking account or savings account. Those with an account, the average balance is around $3,000. But striking to me in terms of comparison to the earlier study I did in the Midwest is that half of these young people own a vehicle. So that's a very important asset for many of them. And I think that's important for us to keep in mind. And then lastly, in this area of connection to important, in social institutions is a sense here of the fact that many of these young people are still having a hard time. So any economic hardship, there's a series of questions we ask. Have you had your utilities cut off? Have you had not had enough money to pay rent, et cetera, not have enough money to pay clothes you need? And about half the young people would say they experienced at least one of those things in the last 12 months. And Lori mentioned food insecurity. Almost a third of the young people, or 3 in 10, basically would qualify for what the United States Department of Agriculture would describe as being food insecure, essentially not having enough food to eat at some point in the 12 months prior to the interview. Let's move on to housing arrangements and homelessness. I know that's very important. So where are youth living? So the interesting thing is very different than age 19. You've got 27 of them still living in a THP program. But again, that wouldn't be THP plus foster care at that point. And you can see that over 2/5 of them are living in their own place, but a whole bunch of them, 1/4, are living with a birth parent or another adult relative. And while that's lower than in the general population, I think it does indicate, we have a number of indicators in the study of connections to family. And for the vast majority of these young people, they do have ongoing important connections to family that are really important for us to help them navigate. And then this indicates how much they're paying for rent. I was really struck by this, that about 3/5 of the young people report paying $500 or less per month in rent. What's striking to me is that 17%, nearly 1/5, are paying nothing for rent. That's what that 17% is. So, that accounts for a lot of why such a huge percentage of these young people are spending $500 or less on rent. But you can see that a significant percentage, about 1 in 5, are paying more than $1,000 a month in rent. And this is how many youth have experienced homelessness. And so basically, I'm gonna stick with the top line finding there, which is about 1 in 4 youth in our study had ever been homeless since their last interview. So that's the percentage of young people who said, I've been homeless at least once since you talked to me at age 19. So that's kind of like a 2-year prevalence rate of homelessness. About 1/4 of them became homeless. And then, as you can see, we provide a lot more data in the report on how many times they've been homeless. Most of them have been homeless more than once, and how long they've been homeless. Most of those homeless spells are pretty short, but over 1/5 of them are longer than a month. So those are pretty long spell of homelessness. Couch surfing, very similar, it's just a higher, and this is not surprising in this age group that got a higher percentage that say they couch surf. Over 1/3 had couch surf at some point in the prior 2 years, and many of them had done that multiple times. So on to other things. So it's more than just survival. It's more than having housing, more than having a job, more than going to school. There's other aspects of well-being that we focus on in CalYouth that we all know are important. So let's see if I can get this up. So this is the number of supported. We get into how many folks are in their social network, etc. And what this slide shows is the percentage of young people. I find this question really important. We define what we mean by emotional support, tangible support, somebody who could loan you some money, give you a place to crash if you needed that, or advice, guidance. And then we ask the young people, do you have enough people you can count on, too few, or no one? And one thing that I think it's important to note is that very, very few of these young people say they have no one to rely on in these areas. However, if you add up the no one and too few people, you get around 2/5 of these young people, 1/3 to 2/5 of young people would say, I don't really have enough people to rely on in each of these three areas. But the fact that most of them are saying, I do, I think is also, I think, a source of resilience and strength that we want to keep in mind. And we also get into how many they have. And this, what I want to emphasize here is this gets into the number of individuals in each area they can rely on. We actually limit that to 3 because we ask specifically who this person is, etc. But the reason I have the slide there is that family and romantic partners and friends account for the overwhelming majority. If you go to the PDF, you can see in the pie charts a lot clearer. They account for the overwhelming majority, 39% and 43% together is family and romantic partners and friends. Professionals account for about 1 in 10, though, of the people that they say are really important parts of their network. And as you'll see, we've already got some memos from CalYouth out there, for example, one on higher ed, that suggests those professionals actually are pretty important, even though they only make up 1/10 of the support network of these young people, in bridging these young people to institutions like employment, but particularly education. So even though I know there's a lot of professionals on the line, you may not be the majority of their network, but you're an important part of it. Criminal justice system involvement. So, and this is just part of the story that's always sobering to me. And this is the criminal justice involvement again since the last interview. So we say, hey, since the last time we talked to you, you've been arrested, convicted of a crime, or incarcerated. You can see that young men are much more likely than young women, but those numbers for young women are very high compared to the general population, and still, I think, sobering. But the fact that over 1/5 of the young men had spent at least one night in jail, and 7% of the young women had spent at least one night in jail since our last interview is again sobering, and something that we're going to be looking into whether extended care reduces that risk. Can't share those findings with you yet, but stay tuned. And then general health status. And this is a bit dated in our comparison, the Ad Health study, but general trends in young adult health haven't changed that much in the last 10 years or so. And basically what this slide shows is there's a higher percentage of young people, significantly higher percentage of young people in our study that would describe their health as fair or poor. So you've got about 1 in 5 CalYouth participants saying, yeah, my health is only fair or poor, whereas it's 6% in the general population. So, generally their health isn't quite the same as their peers. And this is behavioral health, lots of details. Some good news on this slide is that the percentage of young people who said that they had thought about killing themselves or actually attempted to kill themselves since the last interview is much lower than it was. And we see a decline over time from our interview back at 17. It declined at 19. It's declined even more here at 21. And we also have at the right there, 30% of these young people have, according to the screening instrument we did, one or more mental health or substance use disorders. That percentage is also lower than it was at 19. So we see a gradual decline in that. What I would say here, we've got a lot of detail. We've got a lot of detail on their use of health services. And this is very good news here. The vast majority of these young people have health insurance, and even the majority have dental insurance. And most of them have seen a doctor for regular exam in the last year, if not the last year, the last couple of years. And those rates, I think, with respect to basic health and preventive health are encouraging. About 1 in 5 are receiving some kind of psychological counseling, and a little over 1 in 10 are receiving psychotropic medications. Those rates have declined as well. But, that's partly a function of the fact that their the rate of diagnosable disorders has actually declined. But you've got a fair number of young people who have diagnosable disorders that are not getting behavioral health services. And again, that's something that we'll dig into as we start looking in specific outcome areas and trying to understand better what's going well and what's not, and how that might inform policy and practice. So on to pregnancy, parenting, and romantic relationships. And the graphic is really weird, but anyway, you can see that 41% of females had become pregnant since the last interview, and 29% gave birth. So parenting is, again, an increasingly common phenomenon, particularly for the young women. And then for males, you can see the rates are lower in terms of 15% said they got someone pregnant, 12% had fathered a child. But what I would draw attention to, and I didn't on the last slide, so I'm gonna do that though, is that you can see there's a big divide between the young women who said they wanted to get pregnant and those who did not. And particularly once you get to be, 20 years old and you're getting pregnant and you didn't want to, that number should be lower, right? I mean, if somebody wants to get pregnant, they're adult, they can exercise their agency, they have a right to. But there's a significant percentage of young women who did not want to get pregnant at the time they did, and a significant percentage of young men who didn't want their partner to get pregnant. So the work you're doing in California to try to engage in reproductive health, education and interventions with these young people is entirely appropriate to be doing given what's going on in their lives. Children parenting. Wait a second. You can see that about 1/5 of the males and 2/5 of the females have a living child by age 21. And while the vast majority, 2/3, have only one child, you can see 1/3 has 2 or more children already by the age of 21. And I think the good news there is that over 4/5 of the young women are living with all of their children, but 2/5 of the young men are not living with all their children. And this is something we saw in the Midwest study as well. And I think the other thing that is, I think, belies a myth out there, which is all these youth age out of foster care, their kids are all going to go into foster care. Well, that doesn't happen. And while these rates are higher, certainly than the general population, 12% of the females have at least one child who's a dependent of the court, and 7% of the males. Nevertheless, the vast majority of these young people, their children are not dependents of the court. They're raising their children, or they're doing that with help from family, etc. And in terms of romantic relationships, over half the young people are involved in a romantic relationship, and overwhelmingly those are steady relationships. And in fact, half of them, over half of those who are in a romantic relationship, you see the number there, 317, over half the young people in a romantic relationship actually live with their partner. So again, from a practice standpoint, that's really important. By 21, again, 2/3 of these young people were in care to their 21st birthday. Over half of them are in a long, what they consider a steady romantic relationship, and over half of them are living with that person. So that is it. I just wanted to highlight some top-level findings. I know we've got some time to talk here, but let me give you a sense of what's coming next. So as I mentioned, we're doing a summary report on the relationship between extended care and youth outcomes through age 21. And that summary report is going to be based on the survey questions we asked, but it's also based on the administrative data that we've been able to obtain through our partnership with the California Department of Social Services. So we're able to look at college outcomes, for example, using data from what's called the National Student Clearinghouse. So even for youth who didn't participate in our survey, we have outcome data. So I think we got an 85% response rate, but we actually know whether they're going to college, regardless of whether we talk to them at age 21 or not. We also have a much larger sample of young people whose outcomes we can follow using the administrative data. We actually have the child welfare records, maltreatment and foster care history records for anyone who spent a week or more in care after their 16th birthday, going all the way back to 2006. So for some of these outcomes, for education, for employment, for reliance on CalFresh or CalWorks or SSI, we can actually look at change over time from when the law before AB 12 went into effect to afterwards, which is a real strength of the administrative data that we don't have for the survey data, right? Because the survey data, we're really just able to compare young people who stay in care to those who don't, try to control for differences, because there are some differences between the young people who stay in care and those who don't, and see whether extended care is associated with outcomes. And we're very excited about that report. We put a lot of effort into it, and we're really down to the final touches, and expect to be submitting that to our partners at CDSS and the County Welfare Directors Association in the next few weeks. And then probably a month after that, we'll be releasing it to all of you and the broader Child Welfare Services community. We also have a couple of what we call memos. They're shorter reports and more focused topics. One of them is on the impact of extended care on college enrollment and persistence. This is something that we've been working on for a while. We use the National Student Clearinghouse data to see whether extended care has had an impact on whether young people are likely to enroll in college and whether they persist. So whether they stay in college from one semester to the next. As many of you know, the vast majority of young people, and this shows up in our report as well, the vast majority of young people who are going to college in California out of foster care are going to two-year schools. And two-year schools nationally are finally coming under, I think, the kind of scrutiny with respect to accountability for outcomes that they should have been under for many years. And the statistics on the percentage of young people who start community college and are in community college at the end of the year are pretty dismal. So persistence is a real issue. You can get somebody enrolled in college, but are they actually persisting to the point where they get a year of college or they get a credential of some kind? One of the things that I didn't share with you, but that jumps out of our survey data at age 21, is the percentage of young people who say they don't have a college degree, but they have some kind of vocational or trade credential at that point. That's really encouraging, something I don't think we're paying enough attention to in the field generally. And so anyway, we have this memo on extended care and college enrollment. The other memo is on the impact of the implementation of extended care and exits to legal permanency. Some of you might have seen we did an early, I think we call it, early evidence of the impact of extended care and permanency, where we found very little impact of extended care and permanency for older youth. But, the law's been around a few years longer. We were able to add some bells and whistles to our analysis, and we returned to that question of, does the law appear to be having an influence on whether young people exit to adoption or guardianship or reunification, around that transition to adulthood, before the transition to adulthood? We also looked at, young people achieving permanency after the age of 18. You can, in fact, be legally adopted after the age of 18. Does that happen? How often does that happen, et cetera? So those memos will be coming out in the next month or so. And there's the URL for the Chapin Hall website where all of those can be found. And as Kathy mentioned, they will also go up on the Co-Investment Partnership website. So thanks. Happy to answer questions, have a discussion about this or other topics.
Thank you very much, Mark. And before we turn to questions, which we've received a lot of them and keep them pouring in, I just want to take a moment to talk about 3 upcoming webinars that we are hosting that we hope everyone will consider participating in. One is on academic case management, and that is, as Mark was saying, with care now till 21, a young person can make a meaningful start into college in completed career and technical education certification, or even a AA before transferring, or go straight into that 4-year. But it takes a different approach to case management. And so that is on August 22nd. On September 6th, Lori alluded to this, the state legislature and Governor Brown together put $500 million in the state budget to address homelessness in California, and 5% of that is required to go to homeless youth for the first time ever. And so we're going to be featuring two strategies about to use that newly available state funding. We'll be talking about how much every jurisdiction has in homeless youth funding, trying to help you connect with the entity that's going to apply for it, and feature two approaches to consider implementing. And then last but not least is, as Mark mentioned, California is doing a lot of work around reproductive and sexual health, and LA has actually piloted one approach to trying to increase the access to comprehensive sexual health. And so we're going to share that, talk about the pilot, talk about the lessons learned, and this will be particularly useful for counties who are, charged with implementing Senate Bill 89, which went into effect last July 1st, which does require every youth age 10 or older to receive access to comprehensive sexual health once in middle school and once in high school. And so a lot of counties are really doing a lot of good work thinking through that. And so we're delighted to be able to hold up LA County as a county that's really stepping forward and implementing that policy deeply. So with that, I want to hand it over to the questions. And here's one for you, Mark. What did you find about the prevalence of domestic violence within relationships? Does your study discuss that?
Yes, it does. So, and then these off the top of the head answers, I have to always say, don't quote me on this. You can look at the report, but I did look at that as I was going through the 100 slides we have to pick out the ones for the more time-limited webinar. And as I recall, it's pretty rare, around 7%, as I recall, and I think it varies by gender. And I don't think the slide had that. Indicated that they had, pushed or shoved their partner. So that is in the report, and I just can't remember the statistic off the top of my head. But I can say this: the vast majority of the young people feel very positively. We ask a series of questions about get into the dynamics of relationships, and the vast majority of them, those relationships sound very positive. But there is a non-trivial percentage of them where you have instances of bullying, sort of psychological aggression, and then much more rare is physical aggression, but it is there.
Mm-hmm. Thank you. You presented great information. I'm fascinated by this about the rate of arrest and incarceration. Does this study or future studies plan on going into the reason for the conviction of youth involved in criminal justice, like what the charge was?
Yes, we actually do that in this report. In fact, I'm going to see if it shows up here, and it's not. Yes, we ask, okay, you were convicted of a crime, you're arrested, what's the nature of it? And we break it down into 3 different categories: property, against people, and so here I have it in front of me. So convicted, right? So we say convicted of violent crime, property crime, drug-related crime, and then how many of those are for a felony. And overall, it looks like about 25% of the young people say they were convicted of violent crime, 22% of a property crime, 12.5% of drug-related crime, and half of those convictions were for a felony. So yeah, we break it down by, they could have been arrested multiple times, right? So I think we ask about the most recent arrest or conviction when we get into that level of detail, but we do get into the breakdown, and most of these are not violent crimes. Most of them are property or drug-related crimes.
Right. Well, and one thing, this is a question that, I read the report, really enjoyed it, and this seemed consistent with earlier waves, where it seems like your findings are showing young people engage in a lower level of criminal behavior, but a higher level of criminal justice system involvement. Am I understanding this correctly? And if that's the case, how do you think about that?
Yeah, well, so the simple answer to the first question is yes. We're asking young people, and people say, well, it's self-report, they're not going to be honest. But remember, this is the third time we talk to these young people. To tell people, if you don't know, we ask these sensitive questions using a gold standard method, which is we hand them the computer, really. So they're not even having to look at somebody and say yes or no to questions around, did you deliberately damage property? Did you sell marijuana or other drugs? I'm looking at the questions we asked. But when you look at the percentage of times they say never, it's very high. I mean, the percentage of males who answer yes to any of these questions never gets even up to 20%, and most of it's under 5%. And yet, when you look at their criminal justice system involvement, it's much more, prevalent than that. And I think there's a few reasons for that we speculate about, and it'd be worth doing a whole study just on this. But I think that a lot of these young people have criminal records, even at wave one. A significant percentage of young people are minors still, so hopefully those records actually could be done away with. But whether that's happening, whether they have legal advocates that are making sure that happened or not, it's an open question. I think in most cases they don't. But certainly once they're adults and they have any kind of criminal record, they can be arrested again and go to jail again for technical violations, right? They are out of county where they're not supposed to be. There's all kinds of technical violations that can get you back in jail again if you have a criminal record. And that's why when we ask this question, what percentage of these things are property crime, violent crime, drug-related crime, and it only adds up to about 2/3 of the young people who have a conviction. Well, that implies that the other third are likely for technical violations. And then I think a fair amount of the rest of it is just being in the wrong place. If you're marginalized, you're homeless, etc., you're more likely to get picked up for activities that other young people engage in, and they just don't get picked up for it. So yes, you're right, Amy. When I look at self-reported criminal behavior, it's not that different than in the general population. It's elevated for a few things, but it's not that different from the general population. We're asking the questions, exactly the same questions that were asked in other studies, using exactly the same methods. And we see behavior that isn't that different than other young people, but we see criminal justice system involvement that's much higher. And I think it speaks to, the need to reform our criminal justice system, but also I think advocates for these young people. I know that the attorneys that represent them are typically representing them in a dependency court. These young people need zealous representation in the criminal justice system. Many of them need that kind of representation.
That's very interesting. I think as an analogous kind of thing as well, as I read it, and then I will go to all these great questions, is the young people seem to report having sexual intercourse at a lower level than the ad health population, and yet their rate of pregnancy is much higher. So there's something like they're actually engaging in less risky behavior and yet paying higher prices on both of these domains, which is interesting to me. But I do want to get to a lot of these other questions. So Mark, was the issue of undocumented youth addressed in the study? Do you know if youth were unable to go to school or to work due to their legal status and immigration issues?
So that's a good question. We do ask that question, and I don't have the wave one. I don't think we asked it again, right? We asked it back at 17. We might have asked it at 19, but and it was a relatively low rate. Again, off the top of my head, I don't have the wave one report up here in front of me. The rate of young people who were unauthorized, right? I like that term, or if you want to call it undocumented, was well under 10%. It's something that we should look at, but it's not a huge population. And one of the reasons for that, I should say, is that young people in care doesn't always happen, but being in the care of the state is a path to being a legally permanent resident. It's not necessarily a path to citizenship, but if you are dependent of the court, you have advantages over other unauthorized people in terms of establishing your legal permanent residence. And basically by their responses, relatively few of these young people have legal status problems. unfortunately, because there's relatively few of them, even though it sounds like a great, big number, right? 700, we follow up to 600, but if 5% of them are unauthorized, now you're down to 30 people. What's really unfortunate is that, as far as we can tell, the administrative data, the child welfare administrative data, did not clearly indicate. When we started the study, we asked that question. We were told that CWS CMS at that time, anyway, if I'm wrong, I'd love to stand corrected, but that data system did not reliably indicate young people who were unauthorized. And that's the place where it would be great if we had that, because then we could look at employment and college and crime and things like that for that population. But employment and college in particular, where being unauthorized could really limit your options. But we don't have any indicator on administrative data of who those young people are.
Mm-hmm. Okay. Next question is about, was there any data mentioned about drug usage and its impact on youth?
So the answer to the first question is yes. We ask about drug use, and we actually ask, it's in the context of, we ask about smoking too, but it's in the context of our assessment of whether they have a substance use disorder, either dependence or abuse. And so we ask about different substances. That's in the report. I showed you a slide that showed the prevalence of that. I don't have the slide in front of me here. I think it was around, between 10 and 15% of the young people would meet the criteria for a substance use disorder. I think more abuse than dependence. It was higher for males than for females, if I recall correctly. But then again, in this report, we haven't put things together, right? So we haven't yet looked at, okay, are the young people who have substance use disorders, is that getting in the way of their education or their employment? That will become apparent as we analyze those outcomes and share those findings.
All right. So a few questions are coming in, in some ways, as people, and this used to be my former self, now my current self, who work with young people, the young people with the most challenges present themselves often most frequently. People are kind of wondering, is it possible that is this a true selection of the young people, or that maybe we're getting a more functional subset of young people? Is that a question that you get? Because I think people are surprised that they're optimistic, they have graduated from high school, it's not just all bad news. How do you kind of address those kind of points?
Right. So that's a good question, and it's one that we struggle with all the time for a variety of reasons. I'll speak to the one that I'm thinking you're hinting at here. So yes. So first of all, we have an 85% response rate, so that's pretty good. And for those findings to not be generally representative of the population, that other 15% would have to look a lot different, right? I mean, they'd have to, all be in jail or none of them in college, right? And we have other data, right? So we have administrative data on whether they go to college or not. We have administrative data on their earnings. We have administrative data on whether they did CalFresh or CalWorks, for example, or SSI. SSI is a great one, right? You have a disability. And we don't see big differences, but we do see some slight differences. One of the biases we have is that we have a higher rate of response among females than males. And we have a couple hypotheses for that. One is we know, for example, of some young people who are incarcerated in a state prison, and we just weren't able to interview them. It was just, the folks in the prison took forever to, make it okay for us to do it. And by the time they said it was okay, we were done, or they just didn't allow us to do the interview, right? So we knew, I think, of 8 young people who were in jail, all men. They were in jail and we were not able to interview them. So I think it is fair to say that this group is probably a bit higher functioning than the ones that we did not interview. But we also know from other data that, the majority of the folks we didn't interview look very much like the ones we interviewed on things like education, employment, etc. So I guess that's the answer I would give to that. That yes, it's possible, but I don't think that the 15% we didn't interview look radically different than the 85% that we did interview.
Okay. I know this slide is at the very beginning, but so how many young people that you surveyed stayed in care all the way till age 21.
Right, so it's a little tricky. The slide I showed what percentage of them exited on or right around their 21st birthday. That's about 2/3. But let's keep in mind, some of those young people would have exited after 18 and come back, right? Because California allowed that. So if you're asking me how many stayed without leaving, I don't know that off the top of my head. But I know at the last wave at 19, about 13, 14% of the young people had exited care and come back. So if that hadn't changed, then, you know, off the top of my head, I would say probably half or so of the young people we interviewed back at 17 actually stayed in care and never left until they were 21. But then there's another chunk that left at some point, maybe more than once, after they were 18. And because of California's implementation of fostering connections, allowing young people to come back into care, they returned to care. So at the end of the day, about 2/3 of them we started with had just exited right before we interviewed them. We interviewed everybody after their 21st birthday. About 2/3 of them were in care on their 21st birthday or left within, you know, a month of that.
Well, that is very interesting. It sounds like your data is suggesting this reentry policy is being utilized.
Yes, yes.
That's great. A few other good questions. The college enrollment stat, they're wondering, is there retention, you know, to your point about community college often, you know, starting but not finishing, is there any retention metrics included in the study?
Right, so the survey data has some of that, because mainly you have to piece it together. We say, you know, how much college do you have? And so you can see what percentage of young people say they have, you know, more than 1 year, 2 years of college. We ask, what's the highest, you know, level of education you have? But I would say to that, stay tuned. That the more reliable data we think, and it's also just a lot bigger sample, so the estimate's way more precise on college enrollment and persistence come from our analysis of National Student Clearinghouse data, because that makes, you know, they basically tell us, National Student Clearinghouse, we're able to link our child welfare administrative data on this survey group, 700, but also on this much larger group of over 100,000 young people who are ever in care after the 16th birthday. And we see how many enroll, and then we see how many persist. And without spilling the beans on a report that is not public yet, let's just say the percentage that enrolls is actually pretty high. So when it's very consistent what we see in the survey data. It's between 40 and 50% of these young people will enroll in college at some point by their 21st birthday. The percentage that persist for over a year is much lower than it.
So it sounds like,
yeah.
And
so we're getting them in the door, but we're not getting them out the door.
Yeah. Well, will that study include anything on graduate school? That is a question that will the current study that we wave 3 or the one that with the National Clearinghouse data, will that also include graduate school participation?
Yes, it will. Yes.
Oh,
the National Student Clearinghouse. The good thing about the bad thing about National Student Clearinghouse is it doesn't clearly distinguish remedial courses from other courses. So if you go to community college and you're doing remediation, to us it looks like you're in college and we can't really tell. But one thing it does clearly indicate is whether you get a degree, whether it's a 2-year degree, a 4-year degree, or a graduate degree. So yeah, but you know, that's a pretty rare. I know it's not a rare event among the young people we have. They're really involved in it with us making policy, but it's a very rare event to get a graduate degree among young people aging out of foster care.
Yeah, I hear you. Another related question is, did the study examine career and technical education, which, you know, in California is a big part of the community college system? You know, does it look at that? You'd mentioned that there were a not insignificant number of young people who held some kind of certification.
Yes, it does. We asked, but I just typed in vocational into my browser in the report, and there's 33 instances of where we talk about that. So we definitely asked. So among youth currently enrolled at the time we talked to them, almost 1 in 10 were enrolled in vocational training at somewhere. And again, I mentioned, I think it's around 1/4 of them actually have a vocational or job training certificate, actually 1/5. So 114 of the young people we talked to at age 21 already reported having a vocational job training certificate or license. So yeah, we have a number of questions in the survey that go beyond, traditional academic college to vocational job training.
Great. Well, I think we'll make this one the last question. Thanks, everyone, for your patience. You had mentioned when you were talking about behavioral health that there was positive developments in terms of lower rates of suicidal ideation and actual attempts. How about that, the any current mental health or alcohol or drug use disorder, is that improving as well, or is that pretty consistent with the wave 1 and wave 2 in terms of any diagnosis?
Well, it's declined a lot. So I think I reported that 30% screen positive for one or more mental health or substance use disorders at age 21. It was I believe 53% at baseline. So yeah, it's declined quite a bit. The mix has shifted a bit, right? So psychoticism, we don't actually diagnose schizophrenia, but there's a module in there that gets at basically screening for one of the several different kinds of psychotic disorders. That becomes more prevalent over time, and that's not surprising because onset of psychosis is in early adulthood, late adolescence, but particularly early adulthood. But the overall rate of mental health problems declines during this period. We saw that in the Midwest study as well.
Now, at age, just to probe into that a little bit more, at age 17 and age 21, these are, you're doing a battery of assessments directly with the young people. So it's not that, or is it that a professional tagged the young people at having these higher rates when they were 17? I'm just trying to see, because that is, or is it something about getting older, your mental health gets better? I don't know. I'm just interested in knowing your thoughts about that.
Right. So yeah. So we are using, basically, it's similar to what a clinician would do, right? I mean, a clinician would talk to young people in the context of getting to know them, would essentially assess in their own mind, or maybe directly ask the young person about particular symptoms that would be indicative of one or more disorders. We ask those questions. I mean, our questions are asking them about symptoms that are used to come up with a DSM disorder. And, you can look at the report, it talks about this instrument we use, and it's used for this purpose, but it's not, it's not a professional diagnosing them. But by other measures in the survey, are you seeing a professional, right? I mean, that's declined. Psychiatric hospitalizations, they're, fairly constant. They're not going up. And again, people that have that kind of serious mental illness, that, if anything, increases a bit during this period. But the general prevalence of mental health disorders, so depression, anxiety, those, at least according to what the young people are telling us, appear to be declining over time. The decline in the rate and the use of mental health services, I think, is more complicated. That part of that would be expected if their symptoms are declining and they don't feel as much of a need, right? So they're not going to use it. But the other thing that changes, particularly between 17 and 19, is anybody working the system knows you got a young person you're working with and you think they've got mental health problems, you sign them up for therapy, right? I mean, that's part of being in foster care is folks are looking out for you, and they tend to connect you with mental health professionals. Once young people become adults and they're on their own, and particularly they're living in a SILP or maybe THP plus in a less supervised version of THP plus foster care, they're really on their own as to whether they want to engage with the mental health services system. So we think it's a mix of declining prevalence of some of the more common disorders and young people just deciding, I don't think I need help.
Okay. Well, thank you very much. I mean, the study's over 166 pages, and you managed to bring it all to us in an hour. There's a lot there. And so if people have time, we will include that link to the full study. And then also just stay tuned for all this additional great analysis that is coming down the pike. so that we can learn as much as we can about young people in the program and keep honing the program until it can be, one that is helping young people really achieve their dreams for life in career and school and so many other domains. So I want to just close by thanking Lori and Lilia for being on today's web seminar. Thank you, Mark, for being on it, and for everyone who participated. I will do a follow-up email that will include the PowerPoint. A number of you asked if we're getting that. You can download it as a handout as well. And if you have additional questions, there's one person who has additional questions. You're happy to email them to me, and I'll also provide Mark's email. I probably can't answer everyone's, but I know you have some plans to also do some additional presentations here in California. Mark, are you going to the Child Welfare Council? Is that coming up?
Yes, I'll be at the Child Welfare Council meeting. I believe that Lori knows better than I do. I think it's the one in November.
Yes, it's the one. No, it's in December, Mark. December.
December. That's
in
right.
San Francisco. Right. Okay.
Great.
Right.
Well, we will link to that. I mean, that's a great opportunity to hear these findings and get a chance to hear them presented in person and make sure your questions are answered. So again, thanks everyone for participating and presenting, and that concludes today's web seminar. Bye-bye.
Bye-bye.